Hey there, it's Dr. Jim. Thank you for joining me. This episode is about depression and how it's a risk for Alzheimer's disease. This is a really interesting topic, one that I have paid attention to, I would say, for several years. And for some very good reasons, because in the literature and research, it has been established in multiple studies that people with a history of depression run at least a risk twice of that of individuals who do not have depression for developing Alzheimer's disease. So, those with chronic depression, recurrent depression, these folks run a particularly high risk. So if you are someone, if you know someone who is battling depression throughout early life, midlife, or even a little later in life, I want you to know that that is a risk for developing a cognitive disorder later in life. And from what we're seeing in the literature and research, it's Alzheimer's that might be the primary outcome. So there is an association there. Depression, recurrent, lifelong history of, might pose a significant risk for Alzheimer's disease. The question is, why? Well, two questions, why and how? It's still not clear, 100% in research, why this relationship exists. Why is there a link, in other words, between chronic depression and Alzheimer's disease? So finding out this connection would be phenomenal because it could lead to earlier diagnosis of Alzheimer's and, of course, depression with Alzheimer's. And that could lead to perhaps earlier treatment, which would be associated with hopefully better outcomes. So this could be a great discovery for millions of people who suffer from either chronic depression or Alzheimer's or both. And when I was researching this particular topic, I thought about the old imagery of which came first, the chicken or the egg. You know, will we ever know that? So when it comes to depression and Alzheimer's, there is a dilemma. And the dilemma is, which comes first, the chicken or the egg, depression or Alzheimer's? And that is a very serious question in research right now. Depression is a coexisting condition with Alzheimer's disease, meaning that as I'm developing Alzheimer's, I may also experience depression cognitively because I know I'm developing Alzheimer's, I know what it is, I know where it leads to. That's pretty depressing. Or because of the changes taking place in my brain, those anatomical, neurochemical changes are also leading to biochemical depression. There's a tsunami of brain chemistry being affected by these disease processes. So depression, we know, is coexistent with Alzheimer's, and it is sometimes the very first sign that Alzheimer's is actually developing. So there is a need to separate an episode of depression, which is symptomatic of Alzheimer's, from depression that is actually an early risk factor. Do you see how it's getting muddy now? Chicken or egg, which comes first? This is circular, it's confusing. So it gets even more complicated than that. As depression, with or without Alzheimer's, but particularly with, can also be symptomatic of more than one disorder. In fact, Depression is an indicator of many brain disorders. Interesting stuff. Go ahead and do some research on your own. If you're interested in the link between depression and Alzheimer's, I certainly am as a gerontologist. But I'm out of time. But thank you for spending a little bit of time with me. Catch me in another episode soon. My name's Dr. Jim. Take care.